Hi, my name's Sonya Curran. I'm a Chartered Physiotherapist working in the west of Ireland, and today we're going to be covering another condition in my list of medical conditions treated by physiotherapy, and today's topic is hip bursitis. I'm going to show you what it looks like on a chart. The chart shows the anatomy of the hip with two bursa clearly visible, a blue one, which is a superficial one, and a red one, which is a deep one. Both of those can become inflamed and pinched by the muscle. When you have hip bursitis, you often notice you've got a little bit of swelling on the outside of your hip, and it can be quite painful. Often it's painful if you're running. If you're sitting down in a chair, you might pinch it, and you might be able to push on the swelling and inflict pain. Classically, the doctor, when he's testing for bursitis, will get you to lift your leg out to the side, either in standing or in lying, and if you resist it and that gives you a lot of pain, that's your definitive diagnosis that you've got hip bursitis. One of the classic causes of hip bursitis can be flat feet. So again, if you're a runner, addressing your footwear, because that then affects your hip alignment. Also, it can be caused by weak gluteal muscles around there or a weak core. So for an example, if I'm standing on my leg, you can see that I'm nice and straight, that my hip, my knee and my ankle are in a straight line. If I had weak gluteal muscles, my hip would drop to the side, and that would be stretching it and frictioning that muscle and that bursa, causing it to swell up. You can imagine that the bursa is like a bag of jelly. When you tie a boat up at a harbour, you wouldn't want the rope fraying on the harbour. You'd have a tyre between the rope and the harbour to stop that frictioning. It's the same thing in your hip. The muscle would friction over the hip bone, that bony hip bone, and the bag of jelly, the bursa, is there to cushion that and stop that happening. The problem is that that bag of jelly can become inflamed for several reasons. You could have fallen on it, you could be like the waiter, we call this waitress's hip, by bumping doors open. So you go along carrying something and you're bumping the door open with your hip, that causes it to inflame. As I said, you could have fallen on it, or it could just be bad running technique on roads that have got an uneven camber and you're dropping down the whole time. So physio-wise, we'll obviously assess you, we'll look at your feet, give you orthotics if you need them, we'll be looking at your leg alignment to make sure that you're straight, giving you corrective core and gluteal work exercises if required to straighten you up so that your alignment's corrected. We might be using local modalities, we might be able to just treat you digitally. If, however, it's too inflamed, you can sometimes end up having local modalities in the physiotherapy treatment clinic, ultrasound, ice, massage, dry needling. You might also end up having a cortisone injection from your specialist. But it is treatable with help. So I hope you found that helpful, and feel free to contact me if you have a problem. Take care, see you next time.